5, 4,
3, 2, 1.
Not many organizations can boast of 140 years of storied history. University Hospital's health system can. But ours is not just a story of unparalleled compassionate patient care or innovative breakthroughs in virtually every field of medicine. Ours isn't just a story of a great past, but of an organization that thrives today because it is constantly evolving to meet the needs of our patients in the present and in the future. Here now are 10 amazing highlights marking this past year of unparalleled transformation at University Hospital's health system.
10. Number 10. 10.
The transformation started in 2003. By last year, innovative and ongoing system-wide operational changes had led to our second straight year of positive net margins.
A lot of people have worked very, very hard and very closely together to exact the kind of financial turnaround that we've seen in the past 2 years.
Both Moody's Investors Service and Standard & Poor's raised our bond rating. We will continue improving our standing. We will continue to transform.
Number 9.
As financial performance has strengthened, so too has clinical excellence. We know we're one of the best, but it's nice when others say it for us.
Child Magazine reveals the results of its exclusive survey of the country's top children's hospitals. And for that, we go to Cleveland and the Rainbow Babies and Children's Hospital.
They are renowned for their neonatal intensive care unit. They have among the highest success rates with premature infants.
Number 8. Number 8.
We've added key personnel in several areas to enhance the momentum of our financial, clinical, and research progress, including field-leading physicians like Jeffrey Ponsky and Connor Delaney.
Formerly, with open surgery, we'd make an incision somewhere between 6 and 18 inches long. Now with laparoscopic surgery, the biggest incision is often 2 inches or less.
Our roster of excellence just keeps growing. Now, these key individuals will help lead us into a future of even greater accomplishments.
Number 7. Number 7.
In June, 4 University Hospital's organ transplant surgeons conducted Northeast Ohio's first simultaneous kidney transplant.
The patients are part of the Paired Donation Kidney Consortium. That's a group that matches friends and family members willing to donate an organ to a stranger because they don't match their loved one.
The consortium is one of only 3 live paired donation programs in the nation.
6. Number 6. 6. 6. 6. Number 6.
While we transform ourselves, we transform medicine. One team deftly applying minimally invasive procedures for hip and knee replacements to rehabilitate an increasing number of younger patients.
The way we do partial knee replacements nowadays is that we now can do the operation through a relatively small incision, and we basically resurface the knee with a metal and plastic partial knee replacement.
A new generation of longer-lasting replacement joints, coupled with our doctors' refined surgical techniques, keeps these patients enjoying exactly what they want: highly active lifestyles.
5. Number 5.
World-class physicians, pioneering research, advanced clinical trials. We continually develop and sharpen all of the tools necessary to engineer the latest advances in oncology medicine. Recently, researchers at the Ireland Cancer Centre have focused their efforts on one of the most deadly diseases, lung cancer. A new drug called Tarceva specifically blocks cancer cell receptors. These receptors cause the cancer cell to grow and multiply. By blocking these receptors, the cancer cell stops growing. This is just one example of how our efforts may change the standard of care for all patients suffering from cancer.
4. Number 4.
And room lights off.
Great teams define great systems. One team's breakthrough. Surgeon Ray Onder's team performed minimally invasive surgery on a 49-year-old patient with ALS to implant a device that electrically stimulates the diaphragm.
Susan was the first ALS patient in the country to undergo the same procedure that Dr. Anders performed on Christopher Reeve.
Her goal was to make her daughter's graduation and her son's marriage, both this spring. And I'm just overjoyed that after her trip to the University Hospital of Cleveland, she can now make those two events that she wanted to live to.
Three. Number 3.
The Department of Health and Human Services awarded $5 million to University Hospital Health System to devise a model network for electronic health data.
The electronic health record is so powerful because it provides an opportunity for patient-related information to be communicated in a reliable fashion with a single source of truth among caregivers, and it's the most powerful tool to improve quality of care that is available.
Once again, we're at the forefront of the solution.
Number 2. Number 2.
Numerous system-wide success stories all fortify our strategy to ensure that our community hospitals and outpatient centers provide the highest level of care wherever and whenever it is needed in Northeast Ohio.
We have brand new programs in emergency departments, in cardiovascular services, in orthopedics, in spine, and other areas, including diagnostics and imaging modalities across our community hospital system.
One word, wow.
Number 1.
Vision 2010 is the largest single endeavor that University Hospitals Health System has ever undertaken. The 5-year system-wide plan calls for significant building projects on University Hospitals of Cleveland's campus. The plan also features targeted expansion of services throughout the region, along with the implementation of an electronic health record system throughout University Hospitals Health System. Altogether, this plan will enhance and ensure our ability to provide the highest quality, patient-centered care.
This is one of the finest healthcare cities in the entire world, not just in the state, not just in the United States, but in the entire world. And we're building on that reputation.
We know we're very good, but our job is always to do better. It's not to rest on your laurels. It's to continue to advance medical therapy.
Let the transformation continue. Now, all of the pioneering achievements of the past 140 years, all of the transformational planning and improvements of the past few years, all of the phenomenal accomplishments of last year, provide us with a platform to attain even greater success deep into the 21st century. We invite all of you to join us as we move forward into a future of promise and achievement that starts with a clear, bold vision.